Hey everyone, today I want to talk to you about something that I have a very high concern out there when I see labs come back with some things. Now, once again, as I said before, I'm going to go over a therapy that's a very common therapy out there. But remember, it is a medical therapy, so I just want to let you know I don't give any medical advice. If you want to do that therapy or not do the therapy, please talk to your doctor. I just want to go over some of the things that I see on a regular basis and then some of the concerns that the person has when they come in to see people like us. See, a nice thing about being a chiropractor, I recognize some of the things that they do medically, and they'll ask me questions, and I'll say, listen, you definitely want to talk to your doctor about this. But the reason why it was addressed to us because this person came in, and I want to tell you, it's a little story about a 51-year-old woman. She ended up on hormone pellet therapy. Hormone pellet therapy basically they put a little capsule inside you. It's a released hormone. It's more of a bioidentical hormone. It's a very common, popular therapy, and they see some very good benefits with it. I know a lot of people have switched from HRT hormone replacement therapy, which is highly synthetic and more of a straight medication, to more something like a bioidentical hormone, which is getting from different sources. And what they do is now the pellet therapy, they take and inject the pellet therapy in you. They do it both in males and females. But people always come to me and say, Dr. Flynn, do you like, pellet therapy? And once again, let's talk about this. I do see some benefits from it. I do see people, when they do it, they have, and remember, let's just start with women. We're going to talk about women today because this was a 51-year-old woman. The woman came in, and what happened is, from my understanding, she suffered from the normal things that a lot of women happen as she was transitioning into menopause. She hasn't had a cycle for over a year and a half. She saw some low sex drive. She saw other changes in her body she didn't like. She had low energy. So when they got the pellet, they see some positive effect to it that way. But then what happens in this, and this is a random discussion about many cases, because when they inject the pellet in, that will slow release for a certain amount of time, and then you don't get to have any control over what happens from there. So that's one of my concerns. So there are benefits. So people do see positive benefits of using that bioidentical, but some of the concerns come is once those levels are there, they're going to stay that level till the hormone dissipates, and basically there is no more hormone to use in there. So that being said, I have a lab here of a 51-year-old woman. I want to thank one of our wonderful doctors. They sent it to me, and this happens a lot, guys. Nurses, chiropractors, other healthcare providers will send their labs to me. We'll go through it. I'll give them just a little idea on there. Now, what I mean by that is I don't give them advice on what to do as far as pellets or anything like that. I can stay away from that. I talk about the pathways and what can be supported, herbally or nutritionally with certain supplementation, and what they need to do to help try to get those hormones back to normal. Well, this person entered one of our offices, and here's what happened. She did the pellet, and here's what the levels ended up at. All right. Now, just give you an example. Testosterone for her age range should be anywhere from 7 to 46. Her levels were at 147. So 3 times the higher amount it is. Now, if you think of it this way, let's say you look at the hormones, what can you kind of call that? Well, if you look at it this way, the hormones that are in play here are called androgens, okay? Androgens are very important. They're good for reproductive health, cardiovascular, bone strength, muscle tone, brain function, sex drive, fat cell action and location, but also body and pubic hair. So therefore, they're a certain level, and you see androgens very high on PCOS, polycystic ovarian syndrome. Now, this woman obviously did not have that. She obviously had low hormones before she got her pellet injected into her. But then what happened is, and this is one of the concerns. So a concern I have is when they get pellet therapy, it's very common for them to end up with very high testosterone through the course of their care. Now, when that happens, there are some side effects that can happen from that. They could actually just have that high testosterone, and they could actually start to get abnormal hair growth in different areas that they don't want to do. They can also get skin changes like acne. They can get oily skin. A lot of times that can happen also if this happens too early before they're menopausal. If the androgens get too high, it could actually lead to skip periods or even delayed periods. One of the biggest concerns I think that people have the most when I see this happen is as those androgens get very high, they start to see hair changes. They start to see thinning of the hair. It's not as thick, it kind of brittle that way. And it's really sad because what it does, it starts to, cause women to have a little bit of a male pattern baldness. And that's when they get really concerned. So are there significant benefits to doing pellet therapy? Of course there is. If your hormones are low and you replace it with a bioidentical for that time period, there is going to be benefits. So I said, I'm not telling people I'm pro or against them, because I'm not. Because there are benefits to it. Because if you have very low hormones, ladies, there can be cardiovascular issues. There can even be weight issues that came from there. Now, this woman has entered our office and started care with us, and she lost about 10 pounds post all of the hormone therapy, but she just was concerned because her testosterone levels seemed way too high. Her LDL jumped up because of it. And they said, well, it's kind of normal during the therapy, but my concern is it's very common to see testosterone be very high during pellet therapy. So once again, am I saying that there's no benefit to it? No, there's sometimes significant benefits from doing pellet therapy. But I'm sharing a concern today, knowing that when a person actually gets those elevated too high for too long, it can lead to changes. And one of the most common changes that women do see that brings their concerns is the hair changes. Losing hair, a little bit more thinning of it, not as nice and thick, could lead to a little bit of, once again, baldness, even though they're not going to get total male pattern baldness. Now, one thing that also happens when androgens are there and you become dominant from them, it's called virilization, okay? Where they start to take on the characteristics of more male traits because their productions of the testosterone is so high, and they start to actually have traits that are led to them that are coming more from a male. And I like that term, even though, once again, if you want to look it up, it's Virilation, I think, or Ization, virilation. What it does, once again, let me see if I can pull it up here real quick. It's kind of fun. Occurs when assigned females develop traits associated with assigned males. Excess production of testosterone specifically may be what drives these changes in assigned females. Low levels of testosterone can cause, once again, these problems here, but also it can also cause, come from high issues that way. So the androgens are, once again, tested, and the androgens make up a group of hormones, of the sex hormones, called like androstenedione, testosterone, free testosterone, DHT, DHEA. And this woman, due to the pellet therapy, she got very concerned because she started to see some changes that she wanted to address that way. But now, once again, people say, well, doc, will that eventually dissipate? Will that drop down? Yes, it will. No, so if the process in the body can move the hormone, which majority of people can, that will drop. Now, once again, people say, well, what they usually do? Well, the people then usually choose to either continue with that therapy or they try to do something else. Because when they see those levels get that high for that long a time, and if they're seeing any side effects from it, they kind of sometimes want to do a different therapy. It's very important to get your hormones tested. It's very important to see that where all your estrogens, because once again, sometimes your androgens get elevated because it can't convert down to the estrogens. There's a conversion process that happens in different organ systems, including your liver. And also, remember, androgens are produced by things like your ovaries, testicles in males, and also the adrenals, and then they can convert in different forms. So it's very important that you actually start to look at these things. They produce a dominance that can lead to characteristics that most females don't want. And once again, even though a lot of these people are taking forms of medication, I want to make it very clear on this person right here, with the exception unless it's like, a nurse practitioner or a medical doctor, or anybody that has a medical degree, they may talk to them about what to do with their pellet therapy or their hormone therapy. I would never give advice on that and stuff because, once again, I'm just going to try to say, okay, listen, when you look at this person, you need to support the liver and the body so it can actually start to move and convert that hormone out of there. Because once again, even if it drops down significantly, let's say it dropped down half, on this woman it'd still be elevated compared to what it's supposed to be, because once again, you don't want to be over 46 and she's at 147. It's extremely high. Now, I'd be very surprised if this person chose to do hormone therapy after that due to the factors that were happening, having that testosterone for so high. But don't know, if you ask this woman, I guarantee she saw some physical and psychological benefit to doing the pellet therapy. It's just that, once again, there are consequences to it. See, there are consequences to having low hormones, there's consequences to having high hormones. That's why the best thing you do is support to try to keep them as normal as possible. Otherwise, once again, hormones get too low, there's problems. Hormones get too high, there's problems. I've always just had a concern because this is a very common occurrence to see testosterone elevated that highly during that form of therapy. Once again, I'm not discouraging anybody not to do it. I think there's benefits to it. I think people see benefits to it. I just want people to know that if all of a sudden they start to see some negative effects, because I'd make sure that they test your hormones over again. So therefore, you would not be put in a situation to where all of a sudden, because I've had patients when I was in full-time practice that they got pellet therapy or any hormone replacement therapy, became androgen dominant, and it really started to affect their hair dramatically. And the reason why I bring up hair is because it's one of the most known things that women see a change with that really scares them. See, if they see a higher sex drive, they're not really that concerned. If they see a higher energy level, they're not really that concerned, which you can benefit from hormone therapy that way. See, even pellet therapy. But the concern now is when this starts to go too elevated for too long, and then the body starts reacting with some more negative consequences, like very oily skin, like psychological and physical changes, like hair changes, and things that come along with them being too high. All right. Well, I just wanted to pop on really quickly and discuss that with you guys and let you know that, hey, listen, it's exciting to move things forward. And we will see you next time. And we'll see you Monday for sure for our normal live on Instagram, TikTok, and Facebook. And you guys have a great day.